Hello, good morning everyone. This is Peter J. Jacob again, your infection control preventionist of Dr. Sulaiman Al-Abid Hospital. Okay, I'm making this video to give a short and brief explanation regarding standard precaution. Because whenever I talk to healthcare workers, they're having some confusion between transmission-based and standard precaution. So I hope this brief video will help you further understand what is really standard precaution. First of all, I always inform my staff and my fellow healthcare workers that not only the patients are prone from having this infection, but also the people whom we call healthcare workers who are working in the hospital are prone for acquiring these infections, like the COVID-19. When we talk about healthcare workers, these are not only specific to nurses and doctors, but all the people who are working in the hospital, ranging from the administrator down to the housekeeper, are called healthcare workers. And all of them are prone from having specific, different types of infections. And because of that, because all of us are prone for having infection, different organizations came up with different ways on how to prevent us and the patient from acquiring these infections. And one of which is what we call standard precaution. Standard precaution is the same as universal precaution. What is standard precaution? Standard precaution are the precautionary measures that are being observed by all healthcare workers in order to protect us and our patients from having our infection, in having this infection, regardless of the case and diagnosis of the patient, regardless if the patient is communicable or not communicable, regardless if there's any presence of infectious microorganisms or not, regardless if the patient is HIV or no, suspected COVID or not, or maybe the patient is just coming to the hospital just for a simple blood extraction. You need to observe all this precaution in order to protect you and the patient from having infection. One of the common mistakes of healthcare workers are their thinking that standard precaution is only limited to hand hygiene and PPE. Okay, they're correct. Hand hygiene and PPE is part of the standard precaution. However, it is not only limited to hand hygiene and PPE. Actually, standard precaution consists of 11 elements, and we're going to discuss them one by one. To begin with, let's start with hand hygiene. They put hand hygiene on the #1 spot of the standard precaution because they're considering hand hygiene as the single most effective way of reducing all microorganisms. Because all of us can agree that everything we do, we use our hands. When we eat, when we give medication, when we simply assess the patient, prepare the bed of the patient, we use our hands. When we discard medical waste, and when we go to the bathroom or CR, when we drive our car, we use our hands. So all of us can all agree that our hands is a common vehicle for transferring bacteria. We cannot see microorganisms by our naked eyes, but they are there. There are millions and millions of bacteria that are present in our hands. So it's very important for us to perform hand hygiene in order to prevent transferring these bacteria to our patient and causing infection. When we talk about hand hygiene, we have two types: hand rub and hand wash. Be it hand rub and hand wash has the same principle. It has the same technique on how you're going to perform it, and we call it A-lift technique. What is the difference between hand rub and hand wash? Hand rub is the technique that is using alcohol gel or alcohol sanitizer. And because you are using only alcohol gel or alcohol sanitizer, you will be needing lesser time. It will take only 20 to 30 seconds for you to perform the procedure. However, if you're going to do hand wash, you need more time. It will take at least 40 to 60 seconds. In order for you to remember the time frame, multiply the value in hand rub, 20 to 30 seconds, multiply it by 2, equals 40 to 60 seconds for hand wash. For hand rub, you don't need any tissue towel to dry your hands, but if you're going to perform hand wash, you need tissue towel to dry your hands. Be it hand rub or hand wash, like what I mentioned a while ago, has the same technique on how you're going to perform it, and we call it A-lift technique. How you're going to do A-lift technique? I'm going to demonstrate it now. I'm going to demonstrate hand rub, and I have an alcohol gel here with me. Okay. First, when you're working in the hospital, long fingernails are not allowed, nail polish are not allowed, that artificial nails are not allowed, and you need to remove all your jewelries and even watches before you do hand hygiene. Take an ample amount of alcohol, spread it between your hands, okay? And then step 1, start from here. Right palm over left dorsum with finger interlace, and do on the other hand as well. Palm to palm with finger interlace, interlocked, thumb rotation. When you do your thumb rotation, I want you to include this part of your hands, because this is the common missed part when you're doing hand hygiene. Okay, and then after that, you're going to proceed with the tip of the fingers. So the A-lift technique actually consists of 5 steps. Right palm over left dorsum with finger interlace, palm to palm with finger interlace, interlock, thumb rotation, and tip of the fingers. And since I'm doing hand rub, it will take only 20 to 30 seconds for me to perform the procedure. And no need to use tissue towel to dry my hands. However, if you're going to perform hand wash, it will take you 40 to 60 seconds. And it has the same procedure in how you're going to perform it. I have a question. Why I need to perform it in this sequence, in this manner? Always remember, my fellow colleagues, that whenever you're doing any cleaning or disinfection, you always start from the cleanest part to the dirtiest part. In the case of our hands, the cleanest part of our hand will be this part. That's why this is the step 1 of the process of the hand hygiene. And the tip of the fingers is the dirtiest part. That's why this is the last part. So you start with this one and end with the tip of the fingers. And to guide you on when to do hand hygiene, always remember that we have the 5 moments of hand hygiene. How you're going to remember it? 2 befores and 3 after. Okay. Let's go with the first before touching the patient. We need to do hand hygiene before we touch the patient, before we give any medication, or before we simply assess the patient, because we don't want the bacteria that are present in our hands to be transferred to our patient and cause infection. Second before doing clean or aseptic procedure. You need to perform hand hygiene before you give any medication, before you do cannulation to the patient, before inserting a Foley's catheter to the patient. Even if you're wearing gloves, you need to perform hand hygiene. Always remember that wearing gloves is not an excuse for you not to do hand hygiene. Number 3, after body fluid exposure, after you drain a urine, after you do blood extraction, after you do suctioning, even if you're wearing gloves, you need to perform hand hygiene. This time around, you're protecting yourself from the patient for acquiring this infection. Fourth, after touching the patient. Okay, we cannot see the bacteria by our naked eyes. That's why every time after you assist a patient, after you touch a patient, it's important for you to do hand hygiene to protect you again from having any infection. And last is after touching the patient's surroundings. Always remember that bacteria and microorganisms are not only present to the patient, it is found everywhere. It is found in the environmental surfaces, in the frequently high-touch areas in the patient room, in the doorknob, in the remote control, in the telephone, table, curtain, okay? We cannot see the bacteria. So every time you did something to the patient, and right after you step out of the patient room, you need to perform hand hygiene in order to protect you and the patient from acquiring any infection. Okay, to recap, we have the 5 moments of hand hygiene again. First, before touching the patient, before doing clean or aseptic procedure, after body fluid exposure, after touching the patient, and after touching the patient surroundings. Now, we are going to proceed to the second element of the standard precaution, and that is PPE. PPE is short for personal protective equipment. When we talk about PPE, we're pertaining to the gown, gloves, goggles, mask, apron, shoe cover, head cover, and even the PAPR or the powered air purifying respirator are examples of PPE. PPE are used to protect the healthcare workers and the patient from acquiring infection, from acquiring bacteria that can cause infection. Okay. However, I always emphasize to my fellow healthcare workers that it is not enough for you just to wear PPE. Okay? It is important for you to wear it and remove it properly. Because Even if you're wearing PPE, but if you're not doing it correctly, not wearing and removing it correctly, there are still chances that you could still get contaminated and cause infection. Proper wearing of PPE, we call it donning. Proper removing of PPE, we call it doffing. Donning and doffing. And in order for you to remember the sequence, always follow this algorithm. Donning, the sequence will be going up. Elevate your hands like this, it will be going up. And doffing, removing of PPE, it will be going down. Donning, going up. Doffing, going down. What are the steps for donning? First, you start with hand hygiene. Second, gown. Third, mask. Fourth, goggles or face shield. And last is the gloves. Because we want the gloves to be the cleanest part of the PPE before we touch the patient. When you're performing doffing, okay, the first thing that you're going to remove are your gloves because the sequence will be going down. So the first thing you will remove your gloves because the gloves are considered as the dirtiest part of the PPE after you touch the patient. That's why it's the first thing that should be removed. After you remove your gloves, you need to perform hand hygiene because maybe you contaminated your hands already when you're removing your gloves. Okay, that's why it's very important for you to do hand hygiene. After doing hand hygiene, the next thing that you're going to remove are your face shield or your goggles. Always remember that when you're removing any PPE, you're going to touch everything from the back or hold it on the sides. It's not allowed to touch the front portion of all your PPE, or it's not even allowed to pull or tear your PPE because it will create splashes and small droplets in the air. And once you remove your mask, there's tendency that you're going to inhale all those droplets and cause infection. So it's important for you not to tear or hold the front portion of all your PPE because this is considered the contaminated part. After you're removing your face shield or goggles, the next thing that you're going to remove are your gown, okay? And then the mask will be removed when you're outside of the patient room, or in case if you're inside the isolation room, you're going to remove it in the ante room, okay? And then after removing your mask, you're going to perform hand hygiene again. So just a recap, for doffing, the sequence will be remove gloves, hand hygiene, face shield or goggles, gown, then step out of the patient room or step out of the isolation room, proceed to the ante room, then that's the place where you're going to remove your mask and perform hand hygiene again. Now we are done discussing hand hygiene and PPE. Now let's proceed to the other elements of the standard precaution. Let's talk about cleaning and disinfection. It's very important for us to observe proper cleaning and disinfection in order to protect the patients from acquiring bacteria that are present on the surfaces of an object and cause infection. It's very important that every time an equipment or an item is used by a patient, we need to clean and disinfect it. Every time a patient is discharged in the room, we need to do proper cleaning and disinfection of the room. Always remember that when we say cleaning and disinfection, we need to start with proper cleaning first before you do disinfection. Because if you're not going to do proper cleaning, it will result to poor disinfection. Like for example, if you're going to do blood spill kit, okay, or a blood spill kit procedure, there's a blood present on the floor surface, you need to remove the blood first before you do disinfection with alcohol or sodium hypochlorite. Because if you're not going to perform that, or if you're not going to do proper cleaning and disinfection, the organic substance such as the blood can cause some chemical reaction to the disinfectant that we're using and will result to poor disinfection. Other elements of the standard precaution are proper linen management, because if you're going to handle linens improperly, like the bed sheets, the curtains, the patient gown, there are still chances that we can acquire the bacteria from those linens and cause infection to us. That's why it's very important to follow proper linen management. Another element would be waste segregation. We need to segregate our waste properly for non-biohazard waste, like food packaging, boxes, papers, bottles. We need to throw them in the blue or black plastic bag. For medical waste or infectious waste, we're throwing or discarding them in the yellow plastic bag. For the anatomical body parts or red or placenta, we're discarding them in the red plastic bag. And for those items that we consider sharp, such as needle or scalpel blades, we are discarding them in the sharps container. We need to follow also proper sharps management. in order to prevent us from having needle stick injuries, which predispose us to bloodborne infection. So every time you use a sharp, you need to immediately discard them in the sharps container right after you use them at the point of use. Because if you're going to put it somewhere else, okay, there's high risk for you to get needle stick. Okay? So another element of the standard precaution would be proper patient placement. When you talk about proper patient placement, this is where you're going to put the patient. And then you're going to put the patient in a single room, cohort together, shared room, or in a ward. Or in case of an OR procedure, you're going to put them in the last case or first case. Or should I put them in a single isolation room, in a droplet isolation room, or an airborne isolation room? And what else? What are the other important components of the standard precaution? Environmental control. Because like what I told you, bacteria and microorganisms are not only present to the patient, it is found everywhere. That's why we need to control them to prevent them from proliferating or multiplying and causing infection. What are the ways of environmental control? Water analysis, simple as cleaning disinfection, temperature control, humidity control, air cycle exchange, and pressure monitoring are examples of environmental control. Another example of a standard precaution would be cough etiquette. It's very important when you cough, you need to cover your mouth and nose with tissue towel. If it's not available, we need to wear surgical masks, or if we see patients that are having respiratory symptoms, we need to over surgical masks. And we need to educate them on where they're going to discard the soiled tissue and soiled surgical masks. So all those things that I mentioned to you are part of the standard precaution. See, it's not only limited to hand hygiene and PPE. And meaning, all of the things that I mentioned should be applied to all the patients regardless of their diagnosis and in order to protect us and the patient from having infection. So I hope you learned something with my short and brief explanation about standard precaution, and I'm hoping that you will apply it in your duty. Okay, God bless and see you on my next video.